Good afternoon. My name is Judson Sprandel II. I'm a 39-year in practice chiropractic physician in Ohio. Today, I am going, first of all, I want to thank ChiroSecure for inviting me on their show today. And I have talked previously regarding treating veterans in the community. We've talked about the opioid epidemic, and today I'm going to talk about the House Bill 2654 Medicare Reform Act. And let's go to the next slide. Okay, the bill is HR 2654. It is actually titled the Chiropractic Medicare Coverage Modernization Act. Next slide, please. This action step by the American Chiropractic Association is most important action step for Medicare beneficiaries seeking non-pharmaceutical chiropractic treatment and our profession, in my opinion. Next slide. This is a bill introduced in the U.S. House of Representatives that will allow Medicare recipients to fully access chiropractic care full scope. Medicare covers most services performed by chiropractic physicians when performed by MDs, DOs, and physical therapists. Restricted chiropractic treatment coverage has been a discriminatory action for Medicare for the past 50 years. All we are requesting is to have coverage for chiropractic treatment that we are trained and authorized to do. I attended the American Chiropractic Advocacy Day on May 6, 2021. It was, in my opinion, it was a very positive step by the ACA. They were well organized. The ACA resources were just awesome. I had 4 Zoom 20-30-minute video meetings with legal aids from 3 representatives and 1 senator. My take from the meetings was they were very receptive for what we're talking about. However, they don't have any idea what we do. They don't have any idea that we can prevent prescription reliance. So our big chore across the country, in my opinion, is to educate. And we need to educate our legislators. And we need it. And I think the second important group is to educate the employers. All right, next slide, please. Now, what is lost in all the conversation is that the opioid overdose deaths are surging in Ohio and across our nation during the months of COVID-19. The pandemic has exacerbated the opioid crisis, but nobody knows or maybe nobody cares. On August 14th, 2020, the AMA submitted an updated report. It states that as the COVID-19 global pandemic continues, so does the nation's opioid epidemic. Next slide. Actually, in February of 2021, the opioid overdoses were determined to be 30% higher or 29% higher in 2020 than before the epidemic. Now, a year ago in 2019, there was more than 70,000 lives lost to drug overdoses in 2019, according to the National Institute of Drug Abuse. Now, recently here in Ohio, our Ohio Attorney General, David Yost, made 2 interesting statements I thought were interesting. The opioid epidemic, he states that the opioid epidemic claimed more Ohioans in a 3-month period in 2020 than any other time during the epidemic began. He stated that the opioid overdoses may have taken a backseat in our minds last year because of COVID-19, but make no mistake, Ohioans are dying at a devastating rate because of opioid overdoses. And I think this is, I think it's true in all the states nationwide. So the opioid epidemic is increasing. However, the Medicare system has continued to ignore the current health status, opioid prescription drug reliance of their beneficiaries. And they have ignored state and national guidelines recommend the use of non-pharmaceutical treatment for acute, subacute, and chronic pain and dysfunction. Now, the several of the guidelines, and they state the Federal Drug Administration, they state that non-pharmaceutical therapies, including chiropractic, can play an important role in managing pain. The Centers of Disease Control and Prevention stated that extensive evidence suggests some benefits of non-pharmaceutical and non-opioid pharmaceutical treatments compared with long-term opioid therapy and with less harm. U.S. Department of Defense states that chiropractic management shows significant improvement and high patient satisfaction. The Joint Commission on Hospitals states that non-pharmaceutical strategies, including chiropractic, have a role. State attorney generals have stated that when patients seek treatment for chronic pain, doctors should be encouraged to explore non-opioid alternatives, including physical therapy, acupuncture, massage, and chiropractic care. Now, the American Board of Family Medicine states that for Medicare patients with back and or neck pain, availability of chiropractic care reduces the number of primary care physician visits, resulting in an annual savings of $83.5 million. Next slide. Now, as we all know, Medicare is the basis of all third-party payers across the country. Whether you're a member of a national or state association or not, we have to all work together to push this through. We have to start a grassroots course of action. Everybody needs to be involved. We need to contact legislators. We need to contact as many people as we can to educate them as to the benefit of what we do. Now, the ACA has great information. It was provided to us during the advocacy day. And next slide, please. They included a patient flyer, an office poster. They had a 4-page chiropractic common sense strategy for fighting opioid abuse. This is very awesome PDF. They also had a list of tremendous research articles for us to use for the meeting. Next slide, please. The other additional information they had talking points, they had an issue brief, and they also had an awesome 2-page cost-effective, efficient option for Medicare patients. All right, next slide. Now, I'm submitting an example of an email I sent to a legislator last year. It was the same issue with a different number, but legislators need to hear or see the story or know the story, because based upon my conversation with the 4 groups on the 6th, they have no idea what's going on, and it's important to tell them what actually a true life story. But this patient was referred to me by a local pain management medical physician. He was a 47-year-old disabled male. He's had chronic lower back pain for several years. He's also been diagnosed with MS. His past history was medical history was just phenomenal. He was prescribed Vicodin and Percocet for 14 years. He's had injection therapy. He's had trigger point injections and epidurals. He was prescribed medical marijuana in 2019. Now, in June of 2020, a spine stimulator with 16 leads was surgically placed in his lumbar spinal region. A second spine stimulator had been recommended for his cervical spine, which was not completed yet. I asked him, how much benefit has all these treatments been? He says the treatment was minimal and it was very short-term benefit. All right, next slide, please. Now, it's my understanding that these spine stimulators are about $66,000 a piece. Sure could have treated this patient for a lot less cost. But what was bad is I was leery to adjust this patient, and based upon no coverage with either Medicare or Medicaid, I couldn't help the patient because he had no other way of paying for our services. And so, this is a good case where a pain management is trying to use a non-pharmaceutical treatment of mine. I couldn't use it because this patient had no way of paying for his bills. So I'm sure he had to resort back to the spine stimulators and more medications. This story was, they listened to this story very well. So anyway, I provide this to give you all an idea of what to send to these legislators. With emails, it's pretty good to send things to them, and the response has always been pretty well. I mean, they definitely responded to my emails. I have a tendency to be long on my emails anyway. Okay, next slide. So anyway, our chiropractic solution is for the third-party payers, Medicare and Medicaid, to acknowledge the treatment recommendations for national state groups and increase coverage for evidence-based non-pharmaceutical chiropractic treatment. Chiropractic treatment and acupuncture reduces and can eliminate reliance upon opioid prescription medications, injections, and surgery, which prevents additional health problems, prevents drug addiction, and even experiencing life-threatening situations. All right, next slide, please. So our solution is every DC across the country needs to be engaged. Every local chiropractic district has to make this a priority. Every state association has to be involved. Every national association has to make this a primary focus of their associations. I am enrolled in 2 organizations, the American Chiropractic Association, which put together this program for us, and the other association is the Foundation for Chiropractic Progress. They have just tremendous information. They have white papers, they have infograms, they'll do anything you ask for them. They have the most material that we can all use, and we can do it on a local level. All right, next slide. So anyway, my presentation is kind of short and sweet this time, but basically my focus is to all of us has to be involved. We just can't let another group take care of the situation. The more we get involved, the more we get this done. It really will provide benefit to our Medicare recipients. So get involved. If you get any questions, send them to me, and thank you for your time today. You all have a good day. Thank you.